the do not rehire rate for some of these nursing staffing agencies and the nurses that are going out and traveling to these hospitals
Let
so
me ask you
much.
this. So when I think about other fields, right? So like there's so many different professions, and I feel like most people come out of their 4-year degrees not very prepared for whatever job it is. Like they have a work ethic and they have a base
Right.
level knowledge of information of some kind, but if you're going to get into like a marketing brand role or social media role
Sure.
for a consumer product, then whatever degree you focused on might help a little bit, but probably didn't teach you about the ins and outs of navigating corporate
Right.
culture, and like the acumen of great marketing, and all those things have to come once you get into the role. So a lot of people start in an entry level job of some kind where they have 1 to 3 years where they're kind of learning from a manager and from a team and executing all these tasks, and then eventually level up into strategy and whatnot. In the nursing world, does it mirror a similar path, or do you get thrown right into the deep end the second you graduate? Like, what does that transition look like from your
You
degree
get thrown
to
right in.
profession?
You just go right into it. You'll have a preceptor. When you start at a hospital, you're going to get tied with someone. You're going to get onboarded, but there's an expectation that you know how to take care of a patient as a generalist, as an RN. Now, an RN is not going to get thrown into the ICU. That's a specialty, right? That's like another year of schooling. And an RN's not going to get thrown into the pediatric department either. That's also a specialty. So if we're not talking specialties, we're just talking your average, the majority RN out there. Yeah, they just get thrown in. And I'll give you a perfect. I just spoke to someone about this 3 weeks ago. I met an agency, a nursing staffing agency. This is what they do. They staff nurses all over the country for hospitals who need nurses. And they have what's called a DNR rate. Now, in the hospital, DNR is do not resuscitate. That's like usually an old person, right? And they're like 90, and they're like, okay, don't resuscitate that person. They've chosen not to be a resuscitate. This is do not rehire. The do not rehire rate for some of these nursing staffing agencies and the nurses that are going out and traveling to these hospitals. So the hospital that receives that nurse, the nurse starts at the unit. They have a certain level of competency. Are they ready or are they not? The hospital needs them for a certain amount of time.